Hi, I'm John Hovanesian. In this video, we're going to talk about how to inject Dexycu. When putting Dexycu in the eye, it's good to start with the lens centered and getting the wound hydrated the way you like, so it's ready to be sealed. To have the pressure in the eye normal to low normal, and make sure the patient's comfortable so they're not squeezing against the lid speculum. Once you have all that in place, come into the eye with a 27 gauge cannula, not the 25 that it comes with. Go deep under the iris root and then, while sweeping, inject the Dexycu. We're going to break this down in this next case because there's a lot happening here. When you go in this case through the main incision, get out peripheral, deep under the iris root. First, begin sweeping before you inject. You can inject while the cannula is in motion and then stop injecting. Take your thumb off before you withdraw the cannula. It all happens in one quick motion, and it lays down that Dexycu deep in the iris root where it's going to stay put. Now, a little bit of residual Dexycu at the wound or in the eye will not be a problem, as I'll show you in the next case. Here's another real-time case where we get out underneath the iris root with the 27 gauge, always pulling toward you, never pushing away with the cannula, laying down the Dexycu, and then a quick exit motion. If you're going to irrigate the wounds or hydrate the eye after placing Dexycu, do so with a minimum of turbulent flow so you won't dislodge the Dexycu from its position in the ciliary sulcus. Try to avoid pushing posteriorly on the lens if you can. Sometimes you can't help it, but that will keep Dexycu best in its place. And again, the tiny pearls of Dexycu that sometimes are near the wound edge can be left in place or irrigated away. If there's a little bit of air in the cannula, it will cause some of the Dexycu to follow the cannula into the anterior chamber. This can either be removed or left in place because it won't cause a loss of endothelial cells and generally is very well tolerated. I'm John Hovanesian. Thanks for watching.